the meeting on health, or the hearing on health and welfare. We're going to start as a subcommittee, and we'll call the roll when we have a couple more senators available. Senator Black, if you'd like to present Senate Bill 899.
Thank you, Madam Chair. Good afternoon, members of the committee. For the record, my name is Rusty Black, and I represent the 12th Senatorial District. This legislation would increase, we hope, the number of before and after school programs keeping youth safe while their parents are at work. It would expand physical space licensing exemptions for programs serving only school-age children. Only school age, I want to repeat that. This would make it easier for programs to operate in buildings such as community centers, rec centers, libraries, armories, and I think even YMCAs, I was told maybe. Licensing regulations are designed to keep infants and toddlers safe. But school-age youth are developmentally different and do not need the same protections as infants and toddlers. After-school programs currently serve more than 100,000 Missouri school-age youth. Programs may be operated by school districts or community-based organizations such as churches, YMCAs, Boys and Girls Club, or parks departments. Surveys of Missouri parents by the After School Alliance show that for every child in an after-school program, there are 3 more who would be in an after-school program if they were affordable and accessible in their community. I guess that states we don't raise our kids like people like me, where you just get turned down on the street and show back up when mom yells and it's time to eat. In addition to keeping youth safe, after-school programs help youth raise grades and test scores, reduce problem behaviors, and increase school day attendance. These programs are vital to the economy, making it possible for parents to remain productive at work, knowing youth are with other caring adults. And I do want you to know now, before I completely close the questions, there is discussion, should school age have an actual age or document time in there. So there's probably going to be an amendment that I'm going to offer, Chairman, before you guys exec on this, with some agreed upon things that helps everybody identify what those things are. So with that, I'd be happy to answer any questions, and behind me are people that work in the field and can do even a better job doing that. Thank you.
Thank you, Senator. Any questions for the bill sponsor? Senator Moon.
Good morning.
Good morning.
I think I was one of those chaps like you who grew up where you came home when the street light came on, or if you were hungry, you'd go home and get something to eat. And in fact, back then, Mom and Dad both worked, and so we fended for ourselves, but we had a great time in the neighborhood, and I know things have changed. But what prompted the change in this particular bill? You may have said it and I was out, but what's the cause of it?
Senator, as we go through and we have people talk, places that are considered after-school clubs are regulated by somewhat the same rules that at full daycare would be, even including having these toddlers in the facility and babies, infants. Well, because of some of the fire restrictions, some of the other code restrictions, because of babies and toddlers carry on to these after-school networks. And whenever they put those rules in, a lot of it deals around fire, protection, number of people, exits and stuff. When you think about what it takes to take care of a baby or toddler, that doesn't match a 5 or 6 year old. And we need to make these rules, in this case, I believe, match what it's like to take care of 5-year-olds to 14, 15-year-olds. And I think somebody's going to explain it better later, but I'll use this, and it doesn't sound very good, it'll probably be used against me later. When I was doing fire drills, even with 6 and 6th and 7th graders when I taught school, you treated them in a different way than when I was dealing with my older kids or tornado group. My young kids, I really paid attention, did this. All these parents are going to go nuts when they hear this. My older kids, if you're 16, 17 years old and you ain't smart enough to get out of the building when it's on fire, that's your fault, not mine. I told them, I'm heading out the door, you need to do it. That was our training that went on. So it's somewhat the same thing. If you have a baby, you need somebody to take care of that baby, make sure and follow that set of rules. But once they get 5 or 6 years old, we need to look at rules. And somebody's going to bring up also, I'm talking way more than you want, summer camps that are allowed in our state have almost no rules around them. And nobody back there grimace behind me. But the rules are different from the end of school time until September 1 when school starts. I don't know the exact date they use. And then all of a sudden on that day, if Rusty Black was safe in this building on August 31st, on September 1 I'm no longer safe because of this rule that I'm trying to relax a little bit.
When you mentioned after-school programs, that's where I think I turned a corner there. And then you mentioned the babies. So are we talking two different things?
That is correct.
Okay.
The rules that we're talking about are set for babies and toddlers in my mind. And we need to relax these rules a little bit for people that only take care of. I think we're probably going to end up at 5-year-old, maybe 4-year-old on up. Kids that are more able, larger group people watch them, walk to the door by themselves and things like that. But I think, Senator, there'll be people behind that will clear up all the confusion I've caused.
And I'll go ahead and ask one more question, and if you can't answer it, some others perhaps can, but are these services subsidized by the state?
And the answer to that is all the way from yes to probably no.
Okay.
Okay? So,
Okay.
yeah.
All right.
It includes everything.
Any other questions for the bill sponsor? Seeing none, before we take testimony both in favor and in opposition, we're going to pause and have the secretary call the roll.
Senators Coleman. Here. Arthur. Here. Gannon. Moon. Here. Thompson Rehder. Washington. Oh, who did I miss? Carter. I'm sorry, Senator Carter. I checked you as yes. I apologize. I'm so sorry. Okay.
Senator Thompson.
Senator Thompson Rehder.
We have a quorum, so we're going to go ahead and now take, thank you, we're going to take a testimony now in support. Please come forward.
I'm Colleen Abbott. I'm in favor of this bill. I'm in my 10th year as the director of the Eldon After School LEAP program, which serves 650 school-age youth in grades pre-K through 12th grade for the Eldon School District. I'm also the chair of the Missouri After School Network Public Policy and Advocacy Committee. Our committee focuses on increasing access to after-school programs which provide youth opportunities to learn and grow and to assist working parents in keeping their job and remaining productive during after-school hours. As chair of the policy committee, I hear from programs around the state about the absurdity and inconsistency of the current licensing regulations in regards to physical space for school-age students. The pure fact that the law does not differentiate between a 6-week-old baby, a 6-year-old child, and a 16-year-old teenager really does speak for itself. But in case you need some more examples, I'll provide a few. First, the current requirement for licensure depends upon the entity providing the programming, not about the space itself. For example, as a part of the economic development in my own community, I work really closely with our 2 major manufacturers to make certain doors of our school open in time for their employees to drop their children off at our before school program and still make it in time to be on the assembly line when they're supposed to be. If we did not offer this and the business wanted to provide a program for their employees, that space would be required to be licensed for that single hour in the morning. But if our school district chose to partner and provide the programming, whatever space used at a factory or any other building in town would be deemed safe and acceptable under our school district's exemption from licensure. The physical space licensure is a major barrier for businesses to provide before school age, or to provide any kind of school age before and after school programs. Another absurdity that currently occurs, Senator Black mentioned, is that space is deemed safe or unsafe depending on the calendar date. Due to the summer camp exemption, a space may be safe and operate on August the 31st, but then is deemed unsafe and must be licensed in order to operate that same space and the same programming for the same age students on September 1st. Does that really make any sense at all? Finally, I just want to share how critical this is, and I think this goes back to Senator Moon's question about why is this suddenly coming up, and it is really about accessibility and the critical need for care. A lot of the funds that have been that are becoming available are only for the toddlers and infants, and they're not focusing on our school-age students, that parents need care before and after school for their 4, 5, 6-year-old as well. And this really hit home again, and I really focus on accessibility in rural areas because that's what I represent. That's where I'm from. So last week I got a call from my brother who lives on the south side of Fort Leonard Wood in the Plato School District. He and my sister-in-law are veterans who work as civilians in security at the fort. He was really upset because he'd received a letter from his school stating they were discontinuing their before and after school care for kindergarten through second grade starting in June. If this situation does not change, they have no choice but to change their work schedules, likely reducing one or both of their available hours. And there are no options in that community besides that program. I also see the lack of options for those in my own hometown of Shelby County, as the majority of communities north of I-70 have very little access to before and after school programs. When I think about what it would take for someone like me with years of experience to start a program, it's very disheartening and truly near impossible. Even if I have the education, the administrative skills, and there are spaces like a vacant elementary school that was perfectly fine for school-age kids, I would spend thousands of dollars to renovate that space to meet the needs of a 6-week-old baby, which the law would require, even though my youngest potential student would be 5 years old. There's so much need across our state, and the passage of this bill is the first step in recognizing the need for school-age programs to be considered in their own right under the law. I urge all committee members to pass this legislation. Thank you so much for your time.
Thank you for your testimony. Any questions for this witness? Senator Moon.
Ms. Abbott, thank you for clarification. It sounds like you have, and others have recognized that oftentimes government just doesn't use common sense. And I'll speak for myself, sometimes I don't either. But here's something that's even more, I think this is the root of the problem, and I know we won't go back to Leave It to Beaver days when June Cleaver was home most, if not all, the day. But we have, in my view, if you look at what Senator Black had alluded to in his childhood and mine as well, we have gone a long way from what I think where we should, and promoting whole families and the values that I think most Missourians adhere to. And so that's a shame, and it's a shame on us oftentimes. So I'm hoping that we can somehow right the ship where we can actually promote families, and where we wouldn't have to be subject to all these unnecessary rules and regulations to care for our children properly. So that may be kind of around and maybe hidden messages there, but I think government is wrong-sided a lot of times. And anyway, this is probably necessary at the time, but anyway, we need to go back to Leave It to Beaver sometimes.
Can I? Okay.
Thank you so much for your testimony. I appreciate it.
I just really wanted to respond to the fact that another part of this was that until the establishment of the Office of Childhood under the Department of Education, these licensure regulations were in multiple different entities, and so they never really talked together to understand. And then also, before and after school programs that need has grown tremendously in our current economy. And so that is something that at one point in time, there was maybe a single entity that was offering the lower or the younger ages all the way up through school age, but right now there is such a need that the money is in the younger ages, and so lots of different programs have opened up and been established because there is more demand for them than there had been in the past. But the licensure really came to light when everything came under the Office of Childhood instead of it being in multiple different locations as well.
Thank you so much for your testimony. Next witness in support.
Hello, my name is Erin Beline, and I am the president and CEO of Campfire Heartland, which is based out of Kansas City. Over there, I have worked in Kansas City and after school for the past 5 years. We're a full youth development organization and provide after-school programming for school-age children every day of the week when school is in session, and then summer programming. The big difference between what we do and what similar programs like the Y or the Boys and Girls Club do is that we do not have our own building. So over the past 5 years in our organization, we only partner with other entities to provide our after-school programming. Over those years, we have, in the past 5 years, provided after-school programming in 4 parks and rec centers and 6 schools. So these 2 entities have very different licensing rules. During COVID, we opened up for 11 hours a day and took kids because the schools were not open in Kansas City. The state allowed us to be exempt for the course of that year so that we could provide that safe space for children during the day. It took us the full year in order to get that licensing completed, and largely because we ran into barriers with fire safety. So in the Parks and Rec building, these are buildings that are open to large populations of people, oftentimes vulnerable populations, so kids doing recreational activities, and then oftentimes retirees who are going in and doing exercises and swimming. And so these spaces were safe for kids. Whereas as soon as COVID was over, those buildings were expected to be licensed. The barrier here was Parks and Rec in Kansas City spent about $20,000 per building to get it up to fire code. So some of that included putting up new fire doors, adding smoke detectors. There were already smoke detectors there, plenty, but we had to add more in. So the barrier is pretty extensive when you look at cost effectiveness. For my organization, if I would have had to pay the $20,000 to upgrade the building, it would not have been possible. And there are spaces that we would love to be in. The Housing Authority in Kansas City, these are very, very, very low income people who often don't have transportation. So if we can take kids from school and bus them to the community centers within these low income areas, parents can pick their kids up by walking to them at the end. But right now that's not an option for us because it's too expensive to get those spaces licensed. We run into other physical space barriers. You know, for us, there's rules where you have to have baby gates at the bottom of the stairs. We don't need that when we're working with school-age children. They're in school buildings with stairs. They're not tumbling down them. You have to put outlet covers into outlets. Little kids, yes, when you're 2 years old, you might need that, but you don't need that at an older age. We have ran our fire drills in all of these different spaces. Within the Parks and Rec building, the place we had to put $20,000 into license, we can run a fire drill about a minute to a minute and a half faster than we can in a school building. They're smaller buildings, they're brick, they're not combustible, there are lots of doors, we can get the children out quickly. So we've seen that this is a safe place for kids to be. We're working with kids who are of age who can get out the building quicker. We appreciate that you're considering this bill. By passing this, we'll be able to get into communities, low-income communities, places that need this kind of care, and be able to expand our services into those spaces. Any questions?
Thank you for your testimony. Any questions for this witness? Seeing none, thank you. Next witness in support. Mrs. Black, if you'll please introduce yourself.
Hello, my name is Carrie Black, and I am the Executive Director of the North Missouri Center for Youth and Families in Chillicothe, Missouri. And our organization is a little bit different from the previous 2 testimonies. We're a community-based organization in a smaller rural community. In 2015, NAP grant funds were used to convert a grocery store facility into an after-school program. At that time, it was only licensed for 50 students. And then as time has went on, we have seen a growing need in our community, and we look to expand our licensing, which was a real challenge for our physical space. We do serve we have 90 students enrolled, which is our licensing capacity, and we serve over 70 students every day in a before school and after school program. And our program focuses on, we are a 21st century grant program. We focus on academic enrichment, health and fitness and nutrition, developing skills for life and future jobs. In addition to our after-school programming in the summer, we have an after-school program for after summer school, and then we run a 6-week summer month program, which we can put in more career education, field trips, robotics, use of computer technology, and we have an outdoor garden to enhance our nutrition classes. Licensing our physical space has become kind of a challenge. One example we have, when I needed to increase space, we were using what I considered to be a large possibly classroom space for our office. And so we had a computer room, but we turned our computer technology to a mobile classroom. That computer room we could have however many students we wanted because it was under 300 square feet. However, the office was over 300 square feet, and to become licensed space was quite a process. We had to start with a licensing agent, with the fire marshal, and we had to add an egress window in the side of a concrete building. That's always fun. And siding, we had some siding, but that had to maintain licensing requirements. All in a room. It took 9 months of inspections. We had to have sanitation inspections, fire inspections for a room that mirrored a room that was unlicensed space, where our kids could walk out the door and they were within 15 feet of the front door. But we needed the classroom space. But we're met with licensing challenges such as that. I have spent over 30 years in the public education system as both a classroom teacher and administrator of all the way from preschool through high school students. And our age students know how to do fire drills. They know how to follow directions for the most part. And they can get in and out of the building. Because we are a community-based organization, we are directed by a board of directors, and we are a licensed subsidy program. One other thing I'd like to bring up is
Mrs.
that we sit catty-cornered across the street from a state-of-the-art fire station with a full-time fire staff, EMT staff.
Mrs. Black, I am
Yes.
so sorry to interrupt you. We have two
Sure.
senators who are needed to vote and another
Oh,
three senators. So if we're okay to really quickly go out of testimony, and then we'll come back and let you finish so we can exec on these things before I lose these other senators. I'm so sorry.
Okay.
So I make a motion that we go into executive session. Do I have a second? Seeing a second, I motion that we please bring forward Senate Bill 799 before the committee. There's a second. There has been a Senate committee substitute that has been distributed. It clarifies that the judge appointment to the task force is chosen by the Chief Justice of the Supreme Court instead of the governor. This is Senator Eslinger's Human Trafficking Task Force. I'd like to make a motion to adopt this committee substitute. I have a second from Senator Carter. All those in favor of adopting the committee substitute, please say aye. All those opposed, nay. The ayes have it. I now move to pass Senate committee substitute of Senate Bill 799 do pass. Do I have a second? Senator Carter is seconded. This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon. Okay. Thompson Rehder, Washington. Senator Moon.
This was the creation of a task force for human trafficking. Senator Eslinger's bill under the Attorney General.
You said 799.
Yes, sir.
779.
799.
779.
I'm sorry, 779.
That's why
That's why you can't find it. Here, I'm passing you the Senate substitute. I apologize, I misspoke on the number. No, no. Senator, would you feel comfortable voting no, just to let it, and then, so we continue? If you aren't comfortable with it, it would still be able to move forward, and then that way we can discuss it further? No. By a vote of 3-1, the Senate Committee Substitute for Senate Bill 779 has been voted do pass. I now make a motion that we vote on Senate Bill 862, introduced by Senator Thompson Rehder, seconded by Senator Arthur. Senate Bill 862 is now before the committee. I now move that we vote out Senate Bill 862 do pass. Do I have a second? Senator Carter is seconded. This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon, Thompson Rehder, Washington.
By your vote of 4-0, Senate Bill, I'm sorry, by your vote of 5-0, Senate Bill 862 has now been adopted by the committee and voted do pass. I now make a motion that we bring before the committee Senate Bill 863, introduced by Senator Thompson Rehder. Do I have a second? Seconded by Senator Arthur. I now move that we vote out Senate Bill 863 do pass. Do I have a second? Senator Arthur seconds. This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon, Thompson Rehder, Washington.
By your vote of 5-0, you have voted do pass Senate Bill 863 out of committee. I now make a motion that we return to, thank you, that we return to hear Senate Bill 899 and return to Mrs. Black's testimony. Apologies for the interruption. Please continue.
Where I was at was licensing requires several sanitation, inspections, fire inspections. I realize the safety, but our program does serve students ages 5 years to 14 years, and just across the street is the fire station. But many times, because we live a long ways from everywhere, we have to wait on a fire marshal that might have to come 4 or 5 hours to do our inspection. As was pointed out before, our summer program that I explained earlier could be license exempt at one moment and then require licensing the very next day. We are seeing an increased need for the services in our community. Currently, we have a waiting list of kindergarten eligible students. In other words, they're 4 years old now. But for our waiting list for next year, when they are kindergartners, they will need after-school care because daycare providers cannot use the slot because of previous laws, regulations. They can't use the slot for school-age children. So we have more and more parents turning to us. Right now, our K through second is our largest enrollment. And while 90 kids might not seem a lot, in our community it is. And so we are very fortunate to have a community-based organization that we can rely on. And these type of licensing, physical space regulations being relaxed somewhat would just help us further serve those kids, especially those younger kids.
Thank you for your patience and your interrupted testimony. Are there any questions for this witness? Seeing none, thank you for being here today. Anyone else here to testify in support?
Good afternoon, Madam Chair, members of the committee. Gary Gates, the Executive Director for the Missouri Park and Recreation Association. On behalf of our nearly 3,000 members, we are here to support this piece of legislation. I'm not going to repeat all the great things. The Senator has stolen all of my thunder. I will say that our members offer high quality and large variety of educational and recreational activities. There is no difference between a summer camp and an after-school and before-school programming. And being able to operate those with exemption from licensure in the summer and not on days when school is in session, we find troubling, and that's why we support this legislation.
Thank you for your testimony. Any questions for this witness? Seeing none. Next witness in support, please come forward.
Sorry. Afternoon, Casey Nail, representing the Missouri Alliance of Boys and Girls Clubs. We serve 40,000 youth a year in outside of school programming through 71 sites across the state. A lot of those are on school grounds. Some of those aren't. So those folks that are not, our programming goes through the neighborhood assistance program. So like other folks have said, we have a lot of requirements even when we aren't licensed. Some of the licensure requirements are differences in storage space and whether we have laundry on site. So appreciate bills like these to reduce those barriers so we can continue to serve youth. To continue speaking to the increased need, one thing that has gone to the increased need for our folks has been the increase in 4-day school weeks. So that's a whole additional day a week that family need support. So appreciate the sponsor for bringing this forward.
Thank you for your testimony. Any questions for this witness? Seeing none. Next witness in support, please come forward.
Well,
Please proceed when ready.
Madam Chair, members of the committee, Jack Campbell here on behalf of the Missouri Alliance of YMCAs. We are the largest child care provider in the state, and we offer after-school care, summer camps, and this would really help us continue to serve the youth in Missouri. So with that,
Thank you for your testimony. Any questions for this witness? Seeing none.
thank you.
Anyone else here to testify in support? Anyone here to testify in opposition? Anybody here for informational purposes only?
Hi, thanks to the committee for hearing this today. I'm Natalie Hampton, and I am the Director of Policy for Missouri After School Network, and this is Terry Fulks, our Director. I am a registered lobbyist. Missouri After School Network works to support policies and build systems that will increase quality in after-school programs, as well as increasing access to those programs. A couple of things that we wanted to mention. So if this legislation were to become law, there would still be licensing requirements not related to physical space. So that means that programs would still be inspected by licensing reps to ensure compliance with things like ratio, background checks, education and training of staff, records, and reporting. And also, just to be clear, there is just a very narrow group of people who of organizations that these laws currently apply to. So any school district is exempt. If the school has a program in a different building that's not in the school, that space is exempt. If a community-based organization has a program in a school building, that space is exempt. Community-based organization has a program that's on a Saturday or a day when school is not in session, like this summer, then that space is exempt. It's only these community-based organizations if it's on a school day and not in a school building. And do you have something else you want to share?
I wanted to add, there was a comment earlier about the plug covers and some of those type things. Although a school-age program could request a variance for some of these physical space things, that's a time-consuming process and is not an efficient use of the program's time or the licensing rep's time. And the physical space items that deal with health and safety and sanitation and fire inspections, those are not just reviewed by the Department of Health. If there's a variance request on those go to the fire inspectors, and so it's a much more lengthy process. So that was mentioned earlier, and variances are an option, and we have so many after-school programs that do variances, but it would be better if we had school-age specific licensing rules, short of school-age specific licensing rules, addressing this issue will relieve burdens on programs wanting to be able to start in their communities.
Thank you for your testimony. Is there any questions for these witnesses? Seeing none, thank you for being here today. Anyone else here in support, opposition, or informational purposes? Seeing none, that concludes the hearing on Senate Bill 899. Senator Black, if you would like to present Senate Bill 1111.
Thank you, Madam Chair. Members of the committee, for the record, my name is Rusty Black, and I represent 12th Senate District, referred to as the Great Northwest. I filed Senate Bill 1111.
Senator, who refers to it in that way?
All right. Got me off a script. Way to go. You're going to stand up at the microphone up there sometime in the next 2 days, and you're going to lose your script, too. We're that close.
I assume that would happen, yes.
I filed Senate Bill 1111 with the help of the Department of Health and Senior Services to assist families and children with medical complexities. Currently, children with medical complexity, ventilator-dependent feeding tube seizures are eligible to receive private duty nursing through the Medicaid Healthy Children and Youth Program in a one-on-one in-home setting. While this helps some children, for others, this costs them opportunities to socialize with other children, and for parents, this can be burdensome to schedule and potentially require parents to stay home with their children instead of going to work due to the lack of available nursing staff. It also limits the ability for a nurse to care for more than one participant at a time when there are widespread nurse shortages. Therefore, DHSS proposes creating the flexibility for those children to access this service in a child care setting as opposed to in the home. This provides a few benefits, such as, number one, offers children opportunities to socialize with other children both with and without medical complexities. Number two, helps parents have a more consistent method of appropriate and coordinated care for their children with medical complexities. Number three, alleviate some of the critical shortage of nurses to provide PDN services, as nurses will be able to serve a multiple number of children. And I don't want anybody to think that the discussion's one nurse, 30 children with medical complexity, but one nurse, 3 or 4, and everybody remains safe. In order for this to happen, DHSS has proposed legislation changes that would do the following: allow eligible children age 0 to 6 meeting Medicaid eligibility criteria to receive skilled nursing care in addition to other multidisciplinary care, physical, occupational, speech therapy, in an integrated child care setting. In order to provide these services, facilities will be required to obtain DESE licensure, as they would for any other child care facility, and an additional licensure overseen by DHSS that covers the medically complex portion of the care. This structure does not affect DESE licensing in any way. This also only applies to facilities that choose to provide skilled nursing care to eligible medically complex children, so facilities operating a child care facility for children without medically complexities will not see any changes. The only additional cost for this program will be surveying facilities that choose to offer these services. These costs will be minimal, and DHSS can absorb the beginning implementation costs. Once the bill is passed, DHSS will seek additional funding to fully implement. DHSS anticipates this to be within the range of $0 to $130,000, depending on how many facilities choose to participate. Thank you, Madam Chair.
A quick question, Senator. Would this be in lieu of being able to have in-home care, or is this in addition to? And who would
It's
make
an
that
additional
decision?
choice. It is not. That's an important thing for everybody behind me to hear. There was never the idea that we're going to replace one with the other. It just offers another opportunity, and this is another piece of child care that will help, I believe, will help families, and I think we even have a group here that are thinking about doing this and know, it's a big thing to take on inside a child care center. So I think they can do better with telling you how that would happen.
Thank you, Senator. Any other questions for the bill sponsor, Senator Moon?
So is this just another element offered by the Office of the Child, the new or Department of the Child?
This piece is from DHSS, Medicaid eligible kids, young kids that need a nurse, a health professional to help watch them. I mean, the program's already in existence, but in our state, we don't at this point in time have an option for a provider, daycare provider, no matter what daycare provider is behind us, to decide, okay, they're going to physically make a space to handle 3 of these kids or something like that. And DHSS need the authority to also add this option. I hope what I'm saying is correct when they're shaking their head yes. It's to add this option, and we hope people will look at it because of the shortage of healthcare workers as well. And my wife and I, both in our education field and now in her field, we've worked with kids that have had these medical complexities, and it's important to make that available. And I also believe the kids that I dealt with, at least as a school teacher, it was good for them to be able to come to school and be a part of the school program, socialize with others.
So maybe we can talk a little bit more about some of the complexities of it, but on the surface here, the primary purpose of the prescribed pediatric extended care facility would be, in your words, just offering an option for the medical care. And is this primarily in a child care setting, or
Yeah.
would it also be in the school setting too?
Child care.
Child care only?
Child care is where
All right.
this is at. I hope that I'm not corrected on that. I'm pretty confident that I am correct on what I'm saying.
And I noticed in the language of the bill, an eligible child, what would determine the eligibility of a child receiving the service?
Okay, Senator, I'm not going to define that. I need somebody else to
Okay.
do that. But it is, you have a child that's pretty medically challenged and can't take care of them. There's can't be by themselves.
Okay.
All right, and
And that's why you said the 1 to 3 or 4 ratio, because it's
yeah,
gonna.
and that a little bit is my head. Somebody may come up here and say,
Right.
no, it won't be that, but I'm pretty sure that that'll probably be the limit in most places, somewhere in that.
And so I think the answer to the question that I'm going to ask next has probably already been answered. These care facilities won't necessarily be on the school property. They could be, okay. All right, and the cost you said would be $0 to $103,000. Is that for one facility or the entire program?
That it will be additional funding that they could possibly need to make sure within DHSS that they can license and check on these facilities, that they're ready to
Okay.
approve that, because it includes Medicaid funding. So I don't think I'm wrong. Anytime we deal with Medicaid, federal government gets involved too, right? And we have to do some check marks in that area as well.
Then the last question I have at this time would be, on page 2, under section 192.2552, it says that it'll be unlawful for any person to establish, maintain, or operate a prescribed pediatric extended care facility or to advertise himself as such without having, in effect, a written license granted by the department. Is this happening now, in your knowledge?
I believe at this point the answer is no.
Okay.
Okay.
All right,
It's
thank
trying
you.
to allow that option because it's such expensive care.
Thank you. Okay, do we have anyone else wishing to testify in favor?
Senator.
Oh,
Thanks. I just
sorry.
wanted to
Madam
apologize.
Chairwoman?
Thank you, Senator Black. I have another obligation, so we're handing the chair over to Senator Thompson Rehder. So apologies.
My pleasure. So anyone else wishing to testify in favor, come on forward.
Very good.
Please be sure to leave a witness form and proceed when ready.
Hello, my name is Ben Terrell. Oh, this is a terrible angle. My name is Ben Terrell. I am the legislative liaison for the Department of Health and Senior Services. And I do want to say I went to school in the Great Northeast, so I understand, Senator. I refer to it that way. Ooh. And then with me, I brought the division director who would oversee this program.
Hi, my name is Melanie Highland. I'm the director of our Division of Senior and Disability Services.
Senator Black did an excellent job describing this program, but just to answer a few of the questions you asked about eligibility for this program, these would be Medicaid eligibility, so they'd have to meet the threshold to be eligible for Medicaid and have medical complexities, and then they would be allowed into this program, at which point they would have the option to either get these services in-home or in a child care setting. And then what other questions?
The thing that I would keep in mind is that we're focusing on the 0 to 6 age range because we know when that child is of school age, of kindergarten, they have these opportunities for integration with typically developing child in the school. And what we're trying to do is to provide that opportunity in a pre-K environment. You also had asked, are there any facilities that are regulating in this model? That's actually what brought this to our attention. We are working with a provider in St. Louis who has been doing this for a number of years and has been wanting to expand their model, has been asking for this. So we are working closely with them. They have seen the language and to better understand that best practice that's happening there and how we can bring this to other children throughout the state.
And because of current statute, they cannot accept the Medicaid population. So that's why we would be bringing this in. This would allow our program to fee-for-service, to have the flexibility to be able to accept these children under that fee-for-service and provide that level of care. One thing I did want to note, I did not get this word to Senator Black in time. We have reviewed the fiscal note for this bill, and we actually think that because of the efficiencies that this would create with allowing a nurse to take care of multiple children as opposed to just one, the efficiencies would create a cost savings for this program. So we will update the senator on that as well. But I think that's all the questions we had lined up, so happy to take any others.
Do we have any questions for this witness? Seeing none, thank you so much. Anyone else wishing to testify in favor? We are ready when you are, and please leave a witness form. Thank you so much.
You can come on up. Hello, my name is Stephanie Johnson, and I am the Executive Director of the Special Learning Center, a nonprofit organization here in Jefferson City that provides services to children with developmental delays and disabilities. The services we provide are special education for children that are between the ages of 2 and 6, as well as occupational, physical, and speech therapy, both in the educational and clinical setting. But we also provide a DESE licensed child care program for children with special needs. We are here to speak in favor of this bill because though we have a program for children with special needs, and we're able to do that because we have highly trained staff, we keep a lower ratio. It requires us to lean on the donors of Jefferson City for about $250,000 a year to supplement that cost. So we are not imposing that cost on our working families. But the gap is for children with significant medical needs. So when a child has a special need, sometimes, whether that's Down syndrome, cerebral palsy, perhaps they're deaf, we have the capacity to serve them. But if there are situations where they require catheterization, where they require, they have a complex G-tube, where they have situations where if their tone is a certain way where we can harm them, we are not comfortable serving children with those complex needs without a skilled nurse or medical professional in the room. The PPAC would allow us the funding to have a room where we could have children with these complex needs. They would be integrated into as well with the other children in our program. They would receive special education from a licensed special ed teacher. They would receive occupational, physical, and speech therapy. And it would allow them all of those service in a one-stop shop. Just last week, we received a call from 2 working parents here in Jefferson City that have a child with a special need that we could handle. However, the child has to be catheterized every few hours. And that is a liability to do that without medical professionals. So this program would be such a tremendous benefit to our families. I have with us Jennifer Wright. She is our Director of Therapy Services at Special Learning Center, who can speak to the benefits of the children by being in that more center-based environment opposed to the one-on-one nursing in the home.
Thank you for having us. My name is Jennifer Wright, and I am the Director of Therapy Services at the Special Learning Center. And I have been in therapy for a long time and understand that these kids with special needs who are very medically complex often have their lives start and are surrounded mainly by adults in the medical setting. So those children often develop different needs as far as sensory needs or needs to be, they're comfortable around adults, not around children. Well, we know once they get to the school age, they need to have that ability to be comfortable around peers. And so this opportunity would allow them a chance to kind of learn to get away from, their families, be able to be out in the school or childcare setting, to be around peers, to learn as their peers learn those roles, so that then when they start in the school districts, they have those abilities and have already made that initial transition, which can be huge for especially the children who have very complex needs. So it would enable us to kind of get the work in beforehand, so that by the time that they're ready to go on, they have been in those settings and ready for their academic learning. Do you guys have any questions?
Thank you so much. Do we have any questions for this witness? No? Thank you, ladies,
Thank you very
much. We appreciate y'all coming. Anyone else wishing to testify in favor? Mr. Arney, good to see you.
Good to see you. Thank you. Thank you very much. Two members of the Senate. Thank you very
We
much.
have so many, we have all the, trying to play catch up, so I apologize that so many members have had to step
No,
out.
I saw them running out in the hall. They're going to other
Yeah.
meetings, other committee meetings. But my name is Arnie C. A.C. Dinoff, State Public Advocate, and I signed my form online, submitted it. I just want to go on record that I'm in favor of this bill. It seems like common sense, providing other options, and when you're limited to where you can provide health services, I think this is a great additional option. And so I want to go on record in supporting the bill.
Thank you. Any questions for this witness? Seeing none.
Thank you.
Thank you so much. Anyone else wishing to testify in favor? Anyone wishing to testify against? Anyone here for informational purposes only? Seeing none, this concludes our hearing on Senate Bill 1111, and this also concludes our hearing in Health and Welfare. Thank you.